Good afternoon, everyone. I'll just pick up from where Kevin left. So my name is Mumbi Maina. I'm the relationship manager taking care of the health sector in Cooperative Bank, and essentially working closely with the IFC team and OEMs on the AMEF program. So I'll just give a brief background on how AMEF came about. So AMEF came up due to the need to provide quality healthcare, up to the grassroots in the country for Kenya. And one of the things that influenced, AMEF or coming up with the AMEF program is the fact that, most of the healthcare facilities that would want financing probably don't have a bankable proposal. And so one of the ways in which, AMEF also supports these healthcare facilities is by giving them some financial management training on how to better understand their revenue models and how to come up with a business proposal for the bank's consideration. And that's one of the modules that we're working closely with IFC for. So another objective of AMEF was to ensure that we're able to provide medical equipment financing from quality original equipment manufacturers, as you have seen there, and also at attractive rates as well as security proposals. So just to give you an overview on the product features, so the target market for this program would be the clinics, hospitals, medical imaging centers, laboratories, as long as they're registered in Kenya, have been in active operation for at least 3 years, of which 2 have been profitable and of good financial standing. So good financial standing basically means that, if they've had facilities and they've been able to repay them in accordance to how they're supposed to be paid. And also, they're probably not listed on CRB, or if they're listed, then there's a good reason for it. So that's something we can discuss. In terms of eligibility criteria, I think Kevin went through this, but essentially they need to meet at least 2 of those criteria. The first one being annual revenues of between 10 million and 1.5 billion. Up to 300 employees, or total assets of between 10 million and 1.5 billion. So this would probably be the healthcare SMEs. So moving on, the product offering would be under asset finance with the amounts varying from 500,000 to 200 million. Subject to, obviously, the bank doing its due diligence and looking at the documentation and the customer using the approved OEMs. The percentage of financing is up to 95% for the asset finance, with a tenor of up to 5 years. So for the tenor, again, this is a bit flexible because we do take cognizance of the fact that some of the equipment being sold would be having a life of, say, 10 years. So we are happy to put that in consideration and discuss the tenor. In terms of pricing, the interest rate is at 12% with an appraisal fee of 1.5% one-off and an annual review fee of 1.6% on reducing balance basis. And I'm just going to show you, the comparison between what we are offering under AMEF and the normal asset finance. In terms of security, there's no required additional security apart from the equipment itself. Typically, under the normal asset finance, you find that the bank would want additional security, say like a title deed or landed property. So for this, we are only asking for the equipment itself that we are financing to be the security for the financing. In terms of the requirements, we've tried to narrow these down so that then again, we're not asking for too much information. And this will be provided to the healthcare facility that is taking up the financing at the point of, negotiation and discussion with the OEMs as well on the invoice. So in terms of the process flow, so how we envision this working is the healthcare facility approaches the original equipment manufacturer, and once they agree on what equipment they need financing for, then they get the invoice from the OEM. And then with that invoice, the healthcare facility or the customer approaches the bank for financing, and we arrange a site visit to the healthcare facility with the OEM together with ourselves, just to make sure that we know where the facility is operating from, what has influenced the decision to get whatever equipment they're getting, and so on. And then once we get all the application documentation, we go through the approval process. After the approval process is done, we get the offer letter and related documents executed, and then we go on to the disbursement of the facility. So in terms of the turnaround time, amounts below 10 million would take 3 days. Amounts above 10 million to 100 million, 7 working days, and amounts above 100 million to 100 million, 14 days. Once all the documentation has been approved, and this because all these amounts are approved at certain levels. And then one of the key things under AMEF is that we would require the healthcare facility to have a service contract with the OEM, just to protect them in terms of, if there are any issues with the equipment or the machine, then the OEM is able to quickly come in and fix that and reduce the downtime. So this is what I was talking about, the comparison between the normal financing and the AMEF scheme. So the financing under the normal asset finance would be 60% of the total cost. Under AMEF, it's 95% of the total cost. So I think that 35% can be used for other working capital or consumable costs. In terms of interest rate, AMEF is charging 12% interest rate. The normal financing is between 13% to 16%. The tenor, 60 months under AMEF with 3 months moratorium on principal, and this would essentially help you to set up and get the equipment up and running before you have to start paying the interest as well. And then maybe here I can just mention that if the equipment is coming from outside of the country, then the bank is happy to get into an LC arrangement where we issue a letter of credit to the OEM to import the equipment in before you have to start paying for the equipment, and then we give you another 90 days for you to set up, commission, train, before you have to start paying interest on the equipment. The appraisal fee is 1.5% vis-a-vis 3% for the normal financing. No additional security apart from the equipment itself. That's what we mean by self-securing. And then after-sales support will be available from the OEMs under AMEF. In terms of other benefits, you get to acquire equipment from participating OEMs, and these OEMs are, organizations that have been vetted by IFC, and so you're guaranteed of quality. Access to renowned OEMs such as GE, Philips, Karl Storz, Getinge, Wonfor, Electa, and we are going to add more onto this list. Simplified documentation, as I've mentioned. Free periodic training from IFC, access to multiple banking solutions from the bank, as well as a dedicated relationship team. So in a nutshell, that's the AMEF product or program, and that's how it works. And I'm here to provide any additional information that's required. And maybe just to give a live example of how AMEF works, I'll invite Anastasia to just invite the next speaker.